Hello and welcome to our digital presentation on radiation doses in radiology. Today's presentation will go through the current status of radiation doses, concerns associated with doses, and the prospects in development and innovation.
Radiation is the transmission or emission of energy in the form of particles or waves through a material medium or through space. The main source of radiation for people is from sun exposure and cosmic rays in space, but other sources include consumer and man-made products such as diagnostic imaging modalities like CT scans, X-rays, and studies for nuclear medicine. The amount of radiation received by the whole body is determined as the measurement for radiation dose. The scientific unit of measurement is called effective dose in millisieverts. Doctors use effective dose when referring to the risk of radiation to a person and the possible side effects like the chances of developing cancer in the future. X-rays have ionizing radiation which can penetrate the skin and break chemical bonds inside the body. According to recent research, the average person is estimated to receive about 3 millisieverts per year from naturally occurring background radiation. However, these natural background radiation doses vary depending on a person's location. Some examples of the effective dose of radiation for various radiology procedures include bone X-rays, which range from a spine X-ray giving off 1.5 millisieverts radiation dose equivalent to 6 months of background radiation exposure, to 0.001 millisieverts for hand and foot X-rays, which is comparable to 3 hours of natural radiation. A computed tomography CT scan of the head to visualize the central nervous system gives an approximate effective radiation dose of 2 millisieverts, which is the same as going outside for 8 months. A dental X-ray is 0.005 millisieverts, which is only 1 day of background radiation. Nuclear medicine has one of the highest levels of effective radiation dose, reaching up to 25 millisieverts, meaning that a one-time exposure is equal to 8 years of damage. Screening for breast cancer in women is very common. The procedure of mammography gives a very low amount of radiation dose of 0.4 millisieverts, which is only 7 weeks of natural exposure.
There are multiple concerns regarding radiation doses. In this presentation, we will focus on unnecessary radiation exposure and radiation exposure during pregnancy. According to the FDA, when radiological examinations are conducted, the patient should be treated with the optimal radiation. Too little radiation, it will put the patient at risk in developing their disease further or obscure with the image. On the other hand, too much radiation may cause other health defects. There are multiple studies that explain the effects of unnecessary radiation exposure in relation to increasing the lifetime risk of developing cancer. This is because ionizing radiation can cause DNA damage. The prime example of high unnecessary radiation exposure is from the atomic bomb survivors and their offspring from Hiroshima and Nagasaki in 1945. According to this study by McCullough, roughly 2,800 pregnant women were exposed to radiation and around 500 received a conceptus dose of over 10 mg. This gives rise to many complications such as prenatal death, intrauterine growth restrictions, small head size, severe mental retardation, reduced IQ, organ malformations, as well as childhood cancer. However, it does also depend on the fetus's stage of development as well as the dosage it has received. The higher the dose, the higher the risk of having malformations and/or childhood cancer. In a normal radiography setting, if the uterus is in view, the fetus is exposed to scattered radiation, and that could be dangerous if the radiation dose is set too high. This depends on the thickness of the patient as well as the direction of projection. The fetal dose must always be estimated before the mother goes into radiography exams. This is because radiation can cross into the placenta and in breast milk. The radiation doses naturally occurring in the background for fetuses are between 0.5 to 1 millisieverts for the entire gestation period. As seen in the table, these are the doses in early pregnancy from fluoroscopic and radiographic examinations. Lead shielding where possible would be a great way to protect the fetus from scattered radiation. It would also provide the patient with a peace of mind that the child is protected. According to Inojo and Menderes, it is possible to lower radiation doses for fetuses without any significant effects on image quality. This was done by adding a filtration of 2 mm of aluminium. A patient medical imaging report card should be used to keep track of the amount of radiation exposure a patient has previously had. This would also help determine through critical discussions if the risks outweigh the benefits and what clinical options will be best for the patient.
As it has been established, radiation dosage is important to monitor as detrimental effects can arise from high doses. However, it is still important for the dosage to be high enough that the images produced are of acceptable quality. This has driven the field of medical science and medical imaging to strive for enhancements to lower the radiation dosage while improving the quality of the images. One such advancement that has been made is the usage of slot scanning X-ray images, which can reduce the radiation dosage by 6 to 9 times while increasing image quality. Slot scanners work by sending X-rays perpendicular to the body in multiple small beams rather than a large fan, resulting in almost no image distortion and reduced radiation. Software improvement has also played a major role in how medical images are reducing radiation doses. For example, in the reconstruction of CT scans, new software such as Adaptive Statistical Iterative Reconstruction, or ASIR, can drastically reduce the amount of radiation necessary to produce an image. In one study, every second scan was removed before being input into ASIR, which yielded an image with significantly lower noise and higher resolution. In another study, the tube current was reduced from 150 mA to 40 mA, with the resulting images being acceptable for diagnosis. While current achievements in radiation dose reduction is commendable, more research is being put into reducing them further. For example, automated or optimized tube voltage modulation is being designed to allow the tube current as well as the voltage in the tube to be modified for each individual based on a topogram or scout scan. Automated organ-based current modulation is being looked into, so organs which are sensitive to radiation, such as the thyroid gland or the ocular lens, are radiated as little as possible by changing the tube current at different angles of imaging so that the radiation does not reach these organs. And also there are ongoing improvements to reconstruction software such as noise reduction algorithm with image reconstruction and data processing to again reduce the radiation and noise and increase the resolution of an image.
Well, that concludes our presentation. Thank you for watching. You can find our references at the end of this video. All media used is stock and copyright free.